Hello and welcome to our show, Ask Dr. Pickel show, where we are trying to find answers for people with chronic conditions and chronic problems. All right, so today I want to talk about stress and how it affects your brain, because a lot of stress going on right now. I'm sure there's a lot of stress going on all the time, but a lot of patients saying, higher stress levels in the past few months. Due to many things that everybody kind of already knows about to a degree. So we want to address how stress affects the brain and possibly what you can do about it to help the brain and save the brain, which is pretty darn important. So a couple of things as we go into this. When the brain, of course, controls everything in your body. Every single function, every process, everything is controlled by the brain. The brain connects to everything. It is one of our most important areas. Of course, everything functions together, so the brain won't do you any good if you don't have a heart beating or lungs pumping or things like that. So we just really need the brain. Now, there's two things to consider when it comes to the brain, and we'll kind of input stress into this in a moment, but in order to have good basic brain function, you've got to have two very important things. And we're going to call them fuel. Fuel is oxygen, and fuel is blood sugar. The brain has to have those two basic components. Without those, forget it. Forget everything. Nothing's going to work if your brain doesn't have fuel. So now, how do we get fuel? How do we get our blood sugar for our brain? Yeah, foods we eat, the things we intake. That's why blood sugar problems can cause brain problems. So let's say if you're a person who has hypoglycemia, maybe even if it's undiagnosed, which means low blood sugar, and you go too long between meals, you forgot to eat lunch, maybe you just ate a little bit of breakfast, but now it rolls around to almost dinner time, and you're at home and you come home and you say, hey, I haven't eaten all day, I'm starving, and you're irritable. You're what they call hangry. Yeah, so that's your brain function has lowered. What is called your dopamine levels have dropped. So, we'll talk more about that here in a moment too. And then also that oxygen is a big factor. Now, when it comes to oxygen, yeah, we have breathing. And that's the thing we think, hey, I breathe, oxygen should never be a problem because I breathe oxygen every day, all day long. Well, it is a problem if you've got lung issues, if you have cardiovascular issues, because the thing is once you breathe air in to get that oxygen, it's got to get all the way to your cells. Every cell in your body has to have that oxygen. How does it get there? Well, it has to go through your bloodstream. And how does it do that? It does that through red blood cells. Now, what do red blood cells have to have? They've got to have iron. So if you're low in iron, if you're anemic, you're getting less oxygen to your brain. There's different types of anemia. There's not just iron. So some people, low iron. And again, usually you want to see a blood test to see, hey, is iron low? And we won't get into the details of that on this test, but definitely, or on this video, but definitely iron a big factor. And there's also other types of anemias. There are not only these iron deficiency anemias called microcytic anemias, but there's also macrocytic anemias where the red blood cell gets bigger. These are due to either deficiencies usually in B12, vitamin B12, folate, vitamin B6. These can also cause less oxygen to get to your cells. And then, of course, if you have respiratory issues and a lot of other cardiorespiratory type problems, in fact, there's a lot of other problems that could affect your oxygen issues. And even if you travel from Kansas to Colorado up in the mountains, you can suffer from lowered oxygen levels for a period of time until your body adapts if it's working properly. So again, blood sugar, oxygen, we got to have those fuel sources correct. Now, what's another thing that can affect the brain? Inflammation. And we spoke recently about how gut inflammation equals brain inflammation, but anytime there's inflammation in your body or Well, let's put it this way. If there's inflammation in the body, it can spread to the brain. Also, if you have a head injury, you now have inflammation in the brain. If you have a concussion, that's an inflamed and swollen brain. So again, any of these factors can affect you. Now, how does stress fit into all of this picture? So stress basically causes a signaling to go on in your brain. Now, in fact, let's take a step back for a second. There's different types of stress. There's physical stress, emotional stress, chemical stress. Any of these can affect you. Now, short-term stress, there's been some studies done on rats, and they took these rats and they gave them just temporary stress. They said, okay, let's stress them out a little, just a short period, see how they function, and we'll do that multiple times to see what their brain does. Actually, when they were stressed for just brief periods, cognitive function increased. Think of it as, let's say you're studying for a test and you say, hey, you know what? I study the best the night before the test, and then I do great the next day. If I try to study days and days and days and weeks before, just can't get it in. But if I study under the stress of the test is tomorrow morning, it sinks in and I can remember it or I can think it. So this is what those rats were going through. They were getting that low amount of stress for a short period. It's helping their brain to actually remember things or be able to recall things. So now that's a different picture than prolonged stress. If you have stress day after day after day after day, that causes a different effect. That causes your brain to tell your adrenal glands, hey guys, make more cortisol, this anti-inflammatory hormone. Well, for short periods of time, cortisol can be good. But if it gets released day after day after day, this starts to cause negative effects, not only on the rest of your body, but on your brain. Cortisol is kind of toxic. This stress response, this fight or flight response, can be actually toxic to the brain. And there's two main areas that can tend to get affected with this. In fact, let me see if we can do something just to go over that. All right, bear with me for a second here. See if I can change this so I can share my screen and kabam. Okay. And let's move that. All right, guys. Here we go. Okay, so we have our brain. And this is crude. All right. And then we got our brain stem down here. All right. So our brain has different areas in it. Our brain has an area up here in the front. It's called the frontal lobe of your brain. Frontal lobe, pretty darn important. That's the executive area of the brain. It basically controls everything. This is what differentiates us a lot from animals, and that the way this frontal lobe works, this executive portion, especially the very front of that area. So in the very front of that area, there's another section here, and it's called our prefrontal cortex. Now, not to get too far into this, but that prefrontal cortex, extremely important. Now, it is one of the areas in the research that's shown to be hampered by stress, shown to be destructive things can occur to this area with long-term stress. So, in fact, I'll go over those symptoms in a minute, just kind of showing you locations now. Now, think of it too, now on another area of your brain, kind of over in here, there's what's called the temporal lobe of the brain. And within that temporal lobe, there's an area in here called the hippocampus. Let me see if we can, well, I can't click things while I'm doing that. So this hippocampus, I know it's an odd name. This is our memory area of the brain. This area does quite a few different things too, but memory is a big part of this. It is also an area that high cortisol levels are very destructive to. So never a good thing there either. All right. In fact, let's go back to that. Bear with me for 1 second. We're almost there. All right, let's see if we can exit out of that. Bring up this and get back to here, guys. Sorry. Okay, I think we're back in action here. All right, click one more thing. Okay, so let's get back to this hippocampus area, this memory area, and this can be memory for a lot of different things. And this memory can be for, let's say, faces, memory for pictures, memory for auditory things, sounds. I remember the way that certain bird sounds, emotional memories. These are all your basic memory encoding type things here. Now, also, this is where working memory lives. So if we're having a conversation with somebody and we can remember some of the language or the semantics or the logic of that conversation, also that visual memory occurs there. So if I'm driving down a certain road, I can remember, hey, I've driven down this road before. Also what we call episodic memory, which is, hey, I can tell you this story about myself when I was a kid and I went through this and that. That's more of an episodic memory. And then we also have olfactory or gustatory memory. To make that simple, our memory of tastes and smells. So it could be like, gosh, I've tasted this before, but I just can't remember what it is. So again, these, and also not only that, but also an important one that a lot of people will think of is this recall, this retrieval. So if you meet somebody and you're like, gosh, I know them, I know their face, can't remember their name. Yeah, sometimes that'll tie into that. Now, sometimes that can also tie into when you were meeting that person, did you really get their name? So you got to look at that two ways. But if it's a major issue for you, you could be having some hippocampal issues there. And also even new experiences. If I had a patient just the other day who she said she's having some memory issues, she was at work and they did something brand new, put a new procedure in place. The next day she was talking to one of the people who was helping her do that on the phone, and the person said, yeah, remember we did this and this and this. She had no memory of it at all. It was a new novel thing. So again, this is all that hippocampal area, very susceptible to this. So what does stress do? It starts to erase your memory. Not good. Now back to that prefrontal cortex area. Remember we were talking about that area in the frontal lobe of the brain at the very beginning that gets affected too. Now this is also extremely important. This could be your organizational skills. This is your ability to benefit from experience, meaning I've been down that road before and it wasn't good. I remember that, so I'm not going to do it again. Of course, that benefit from experience can be good things and bad things and many other applications to that. Abstract thoughts, or just being able to use abstraction or thinking outside the box. Also, this area is very important for drive and motivation. So some people will say, gosh, I just feel like I could just sit in this chair all day and do nothing every day. Yeah, that's lower drive and motivation. And then also what we call cognitive flexibility. That's, again, can I kind of think outside the box? Do I have to always, if somebody says do it this way and I do it that way, but I start to think, hey, maybe there's a better way to get this done. This cognitive flexibility. And then, of course, that also ties into another major part of this area of the brain, which is problem solving. If I have a problem, how can I solve this? So, these faculties can start to decline with chronic stress, which, of course, is never a good thing at all. And when you start to notice cognitive decline, well, let's put it this way. Where does dementia and Alzheimer's affect? Mainly this hippocampal area and this frontal lobe area of the brain. So we don't want to go down that road. Can chronic stress push you into those things? Possibilities, because chronic stress activates these negative factors in the brain that lead to destructive processes. So not a good thing. All right, so what else can stress affect? Let's say you have low blood sugar, let's say, or you have an anemia, or you have inflammation in your body. And remember, gut inflammation equals brain inflammation. So these things go hand in hand. But if any of these problems exist, or even again, the chronic stress issue, that starts to affect our brain's ability to manufacture what are called neurotransmitters. Neurotransmitters are these this brain chemistry that we have that allows us to perform functions. It allows our cells to communicate between each other, and it allows us to offset, let's say, emotional type stresses and traumas. So what are the main neurotransmitters that you hear about? I mean, there's actually a lot of neurotransmitters, and there's even neurotransmitters that in science are not even really known yet or totally understood at all. But there are some main ones that we know quite a bit about. Now, the main ones are serotonin, dopamine, GABA, and acetylcholine. Let's see here. Let's see if we can make this a little easier here. So serotonin, let's say you're low in serotonin. And now again, kind of backing up a little, if these neurotransmitters are low, meaning they're not being produced at a good rate, we have to think what's involved in their production. How do you manufacture neurotransmitters? Well, number one, you got to have good blood sugar. Number two, you have to have oxygen to your brain. Number three, you can't have a bunch of inflammation in the brain. Those components are crucial. Now, also there's some ingredients that come into play too, such as amino acids, vitamins and minerals. They play key parts in the production of these neurotransmitters. And many people are low in those or have genetic issues that make it to where they can't utilize those vitamins, minerals, amino acids as well as they should. So sometimes they even need extra support. So as we get to serotonin here, let's say, I'm not going to get into details because we may do separate videos on all these neurotransmitters, which I think would be great. So, of course, I think they would be great because this stuff excites me. And I hope it does you too. So, all right, so serotonin, when it goes low, what can happen? Usually this is when you feel kind of hopeless. You feel down. You feel more like down, and I feel like crying. There's really, life just exists to exist. There's not much. I've lost all interest in my hobbies, things like this. Now, again, if you take a medication called an SSRI drug to increase serotonin, does it really increase serotonin production? No, it just kind of keeps serotonin floating around a little longer. It's called a reuptake inhibitor. So it prevents that serotonin from degrading so fast. Although a lot of your SSRI drugs, again, the side effect lists are pretty darn long, as with majority of drugs that help with neurotransmitters. So, and I'm not here to bash medications, but just to kind of go over these neurotransmitters and what it may look like if you're feeling some issues from these. Dopamine, we kind of talked about. If dopamine gets low, it usually drops low with people with lower blood sugar, which can make you feel hangry, which really is irritability. So if you feel irritable, if you feel like everybody just leave me alone, I don't want to talk to anybody, and if you come talk to me, I'm going to strangle you because I'm angry, then that's low dopamine levels. Dopamine also ties into your ability to maybe not be as distractible either. So people who are real distractible, like, hey, I'm working on this. Oops, there's something over there. Oops, there's something over there. That's also usually dopamine. GABA. So GABA, whenever you see GABA, think anxiety. GABA is going to tie in a lot to sleep. Also serotonin does. But GABA, especially if you feel anxious, if you feel overwhelmed a lot, if you feel like, in science they call it the impending feeling of doom, any of these things are more toward GABA. And then another one here is acetylcholine. Now, acetylcholine, focus, concentration, memory. So this especially affects those frontal lobes a lot, as does dopamine. Oh, actually, they all do, but certain ones have more of an effect on giving you that drive and motivation and focus, concentration. So any of these neurotransmitters can be affected. So what can we do about this? Well, in fact, let's go back a little bit. what can we do to maybe help this hippocampus, this important memory area? Again, number one, make sure you have fuel for all these areas. Make sure your blood sugar is good. If you've got a blood sugar issue, and when we think blood sugar issues, no, it's not always diabetes, pre-diabetes. You could have hypoglycemia. You could have dysglycemia, which means your blood sugar roller coasters. You have both high and low blood sugar, which a lot of times tricks the blood test. And the doctor will say, oh, your blood sugar looks fine. But you're like, hey, I know if I go too long between meals, my blood sugar dropped because I feel those low blood sugar symptoms. And then when I eat, I feel like I need to take a nap after a meal, or I feel like I need a bunch of sweets after meals. These are these high and low blood sugar symptoms that we don't want. So any of those blood sugar issues can compromise the brain. And again, testing for that, pretty crucial. Back to oxygen, do you have anemias? Do you have these problems that also are compromising this? You got to find those things out, because if you do, you got to address them, or nothing will work. No supplement you take, nothing else will work. If you aren't getting oxygen to your cells, forget all your other symptoms, forget everything. If these foundational things are not in place, forget it all. These are blood sugar, oxygen, these are foundations for everything. You can't even start the car unless you have gas in it. Let's put it that way. All right. So as we get back to the hippocampus itself, there's some research. Actually, there's quite a bit of research that a nutrient called phosphatidylserine is very good for this. And many of you have maybe heard of phosphatidylcholine, which is also very good for the brain, but phosphatidylserine, and actually they do sell phosphatidylserine in a supplement form. Sometimes they put it in combination with other things, but phosphatidylserine, very good. They even have transdermal types. Again, very good for that hippocampal area. And what has been shown in the research is that it helps increase transmission between the nerve cells within the hippocampus. And it's also supposed to maybe decrease or help prevent degenerative effects of that hippocampus from high cortisol levels. So that's one thing. So then we'll go back to serotonin. Serotonin, what can help with this? Now, a few things. And again, if you're already on certain medications, anytime I say, hey, try this, try that, I don't even really say that. I just say, hey, these are potential things that can help. You need to watch, look for interactions, things like that. Ask your pharmacist, ask your doctor before you take certain things. But there are certain things that definitely help with serotonin. One of those is called 5-HTP. 5-HTP is a direct precursor to serotonin. It turns into serotonin, and you can take 5-HTP, and it can help your body to make more serotonin as it needs it. So serotonin, pretty important. Now there's some herbs that influence serotonin. One of our favorites that we've talked about in past videos, melatonin. Melatonin actually comes from serotonin. So people who are low in serotonin are going to have trouble manufacturing their own melatonin, and this can, of course, equal sleep issues. Now, also melatonin can convert back to serotonin, especially if you take melatonin and you're around a lot of light, you can convert that back. All right, and then dopamine, what can help here? Again, this is a big one where it's keeping blood sugar stable. Usually finding out there's usually adrenal gland issues with this. A few things with dopamine. I mean, you can help on the blood sugar side. If you've got high blood sugar, you may look into things like berberine, chromium. Again, there's other things that can help with that, with blood sugar. And then for dopamine itself, to just help increase that, if blood sugar isn't as much of an issue, you can use an amino acid called L-tyrosine. L-tyrosine, again, can be a pretty powerful amino acid to help increase dopamine in a big way. So that's always good. And then GABA. So, again, if you have these anxious feelings a lot, if you feel overwhelmed a lot, that could also be serotonin. But if it's GABA, the way you can increase that is some people will just take GABA. Now, here's kind of an interesting thing about GABA. Gamma-aminobutyric acid. Say the long word there. So GABA, if you take GABA and you're like, gosh, I took GABA, I had the best night's sleep of my life, I felt so calm, I felt great, not a good thing. I hate to say this, GABA should not be able to cross the blood-brain barrier. So if you take GABA, we call it a GABA challenge, and it's actually a test. If we give people GABA and they feel better, then this just told us that they have a leaky blood-brain barrier. Their blood-brain barrier is compromised. There's actually a, let's call it a fence, a barrier between your brain and the rest of your body to protect your brain. And just like we can have leaky gut because of inflammation in our gut, we can have leaky brain where inflammatory products breach our brain barrier, get into our brain and cause problems. So if you feel great with GABA, not a good thing. There's other ways to get GABA up. One of them that's really good is in another amino acid called taurine, L-taurine. Taurine is nice because it helps increase GABA without making you so tired. Because a lot of times when people take things that help GABA, it makes them feel tired and sleepy. So that's one of them. Another one, though, that works good if you need the sleep and you have anxiety can be an amino acid called L-theanine. So L-theanine can also work good, but I find that L-theanine does make people tired. So it's a good one to take more before bed if you have these types of issues. And again, there are other things for these. Now, acetylcholine, again, that one for focus, concentration, memory. If we want that to come up, probably one of the more important ones for that is getting up choline levels in our body. Choline, many food sources for these things, and all of these amino acids I just mentioned, increasing the amounts of foods that have these things. You can Google, hey, what is high in tyrosine? What's high in this and that? You know, what's high in choline? Eggs are high in choline. Nuts are high in choline. So increasing these things, very good brain foods. Also, you can get choline from supplements. You can get phosphatidylcholine. You can get a supplement called alpha GPC, which again, also it's a very bioavailable form of choline. So, but again, by increasing this choline in our system, yeah, that converts to acetylcholine and can help us a lot. I like the alpha GPC because it has the acetyl group and the choline, so you get everything you need. Whereas if you just take phosphatidylcholine and you're low in what are called acetyl groups, then yeah, that can be a problem and you don't have all the components you need to make that. And also, well, we won't get into that today, but yeah, so again, it's doing these things to try to up these neurotransmitter production levels, which can help you to offset the way stress hits you day after day after day. But again, those foundational things are crucial. And I know I can't emphasize enough how important blood sugar is, how important oxygen is. So if you've got basic problems with anemias, and again, I'm going to go back to anemia for just 1 second because it's so crucial. A lot of times on blood tests, anemias aren't talked about by doctors until they get to extreme levels. If you have a blood test available and if you've had like, hey, I got my blood run not too long ago, how would I know if I'm low in iron? Well, a lot of times they might look at just your hemoglobin. If they only tested your hemoglobin, it'll say HGB. If they only tested that, then they're not even looking. It's really not a good thing. They need to be testing your serum iron levels and your ferritin levels, especially ferritin. And if your ferritin drops below a 50, you could be suffering from iron deficiency anemia. There's a few other tests for iron that can confirm that even further, but that key one is called ferritin. That's the iron stored in your liver. Your blood sugar, also another thing that isn't usually red flagged on the low side until you get to an extreme low. Some labs don't flag low blood sugar till you get to below a 50 or below a 60. I don't like to see a blood sugar below an 80. Once you get below 80, that can be potentially reactive hypoglycemia. So if you look at your blood test and you're at a 70 or a 75, yeah, you probably have a potential for that. And some people say, oh, well, I fasted for that. My blood sugar will run low. No, if you fast, your adrenal glands kick in and pull blood sugar out of cells to keep you going. So, which is cortisol. So again, if your blood sugar runs below that 80 mark with a fast or while you sleep at night, yeah, you can't regulate blood sugar. Your adrenals are not working properly. You're getting low blood sugar. And then if you get up above 100, that's a problem too. Now, the better marker for looking at high blood sugar is going to be that hemoglobin A1C test. And anybody who has had a high blood sugar knows that test by heart. Their doctor's going to look at it. And again, we don't want that high, of course, because then you're making large amounts of insulin, which is inflammatory. So, and one more thing that I won't touch on completely here that's good for the brain as a whole is fasting. So when you fast, you take pressure off the gut, you take pressure off the brain. But again, the main thing with this and what we're talking about today is stress and the way it affects the brain. You can't take all the stress out of your life. So the things that you can take out, take out. The things that you can't, you got to modulate by being careful with your diet, exercising, prayer. Some people even do some meditation, things that will help you to relax, things that bring you out of that fight or flight mode are going to be crucial to you. Now, let's see here. I thought I had one more thing here. And I hope everybody, there was a comment in here about sound. I hope everybody got their sound back for the video, and I hope everybody enjoyed the video today, and I will see you all next time. If you get a chance, don't hesitate to, you can find us on both Facebook and YouTube. Don't hesitate to give us the thumbs up or share us. Good stuff, and God bless, and I'll talk to you next time.